My name is Sophie Hayes. I'm an intensive care nurse. So it's more of a combination of a personal and professional journey for me. So my partner had Crohn's disease and was diagnosed 2010, and we found that he was using illicitly at university, and he found that it was really helpful for his symptoms like nausea, sleep, appetite stimulation, gut motility, pain predominantly. And I think being the kind of people we were, we didn't actually weren't happy to just keep it as that's just how it is. We wanted to find out why that was and whether other people experienced the same thing. We knew it was available in the US in some states, so we found other people online, other patients who found that it was helpful. So we had met patients who had conditions such as multiple sclerosis, epilepsy, rheumatoid arthritis, anxiety and depression, and they were also finding it helpful. So between them, they set up the United Patients Alliance, which was a non-profit organisation for patients wanting cannabis on prescription, or to change the law so that would be possible. And we went around the country sort of educating people, and and obviously by the time, when it got to November 2018, after we'd sort of done a lot of campaigning, and by all means United Patients Alliance was not the only group that was in that space that played a significant role in changing the law. There's a huge amount of people who contributed to that and who made it happen. So eventually the law did change in November 2018, and that was incredible. And so that, for me, my interest in medical cannabis has come from, started in a place where it was my partner and watching him suffer and then not suffer as much and see the impact that cannabis was having on him, and then from meeting hundreds and hundreds of patients throughout the next 5-6 years who also found it helpful. And it was just fascinating to me that it had these applications across so many different conditions, and as a clinician, as a nurse, that started to become even more fascinating to me, that it was able to help so many people, so many symptoms. I was headhunted. I didn't go looking for a job in cannabis as a nurse, but I got someone recommended me. Someone was setting up a clinic, and I was recommended, and I met the management team of Integro, including our senior clinician and Dr. Ordman, and I was interviewed by everybody. It was a very thorough interview process, and what struck me at the time was that it felt like they were looking for the right people for their team, to create a positive team environment, and that the focus, for me, it was really important that the focus was on applying cannabis medicines in clinical practice and applying clinical understanding and methods to a new medication, and that is how I felt that it was the best way to go about it. So that's how I joined Integro. I think it's been fascinating, and I really enjoy my job. It's a combination of multiple things, but I really love talking to my patients, and I love that I'm available for them to call me, and they feel that they can contact me with any questions at any time. I love developing that relationship long term with patients, and for me, one of my favourite things in the week is to do our MDT, to assess each person individually as an entire clinical team and discuss thoroughly not only the pharmacology, the biomedicine of that individual, but also the other important things that nurses often get encouraged to highlight, which is that we're looking at each individual person and their lifestyle. And I've said it many, many times as a nurse, where as a consultant, you can create a beautiful care plan for a patient. It would make sense for them on paper, but if it doesn't fit with how they take medication and how the things that they value in their life, or their job, if it doesn't fit with their life, then it's not the right care plan for that patient. And that's one of the things that I like working out and discussing with our team at Integro. like I said before, it's got a huge, it's able to manage multiple symptoms across multiple conditions, and I think that it's, when you say how can medical cannabis help, it's able to manage things like with the right medication and the right person. It's able to manage things like pain, nausea, like chronic migraines has been a really interesting one to manage. It does appetite stimulation, gut motility, muscle relaxation. It's also one of the things that we really encourage at Intergrow, and I'm really proud of being a clinical team that does this, which is there's the medication that we prescribe, and then it's how that enables people to engage with other therapies that may provide them with more long-term relief. Like if you are able to manage your pain better and relax your muscles really well, you're able to engage with physiotherapy, which previously you may not have been able to do. I've had patients go back to doing yoga. I've had patients who now go sea swimming from not being able to move out of bed. I've had patients who are just thrilled to be able to go and see their little girl do ballet, and getting down and playing with their kids and walking their dogs, and it's for me, cannabis medicines are able to manage symptoms, but it's really the combination of the patient and the clinical team that encourage patients to go and use that change that they're experiencing to make further long-term change. I think that's brilliant.